Hives, also known as urticaria, are raised, itchy welts that appear on the skin. They can be triggered by a variety of factors, including allergies, stress, or even temperature changes. While hives are usually harmless and often resolve on their own, they can be uncomfortable and sometimes alarming. In this video, we'll walk you through the safest ways to respond to hives at home, ensuring you know what steps to take to ease discomfort and when to seek medical help. Let's start by understanding what hives look like and why they occur. Hives typically appear as red, pink, or flesh-colored welts on the skin. They can vary in size and shape, sometimes merging to form larger patches. The welts often itch, burn, or sting, and may move around the body. Recognizing these signs is the first step in responding safely. It's important to note if the hives are accompanied by other symptoms like swelling of the lips or difficulty breathing, as these could indicate a more serious allergic reaction. For most cases, however, hives are limited to the skin and can be managed at home. Understanding what triggers hives can help you prevent future outbreaks. Common causes include allergic reactions to foods, medications, insect stings, or environmental factors like pollen. Sometimes, physical triggers such as pressure, heat, or cold can also cause hives. In some cases, stress or infections may be the culprit. Identifying the cause is not always straightforward, but keeping track of recent exposures or changes in your environment can provide valuable clues. Before taking any action, it's crucial to assess the severity of the hives. Are they limited to a small area or spreading rapidly? Are you experiencing any difficulty breathing, swelling of the face or throat, or dizziness? If you notice any of these severe symptoms, seek emergency medical attention immediately, as they could indicate anaphylaxis, a life-threatening allergic reaction. If the hives are mild and you're otherwise feeling well, you can proceed with safe home care steps. The appearance of hives can be distressing, but it's important to stay calm. Stress can sometimes make hives worse, so take a few deep breaths and remind yourself that most cases are not dangerous. Keeping a level head will help you think clearly and take the right steps to manage your symptoms effectively. If you suspect a specific trigger, such as a new food, medication, or environmental factor, remove it immediately if possible. For example, if you recently ate something new, stop consuming it. If a new soap or detergent was used, rinse it off your skin. Avoiding further exposure to the suspected trigger can help prevent the hives from worsening. Applying a cool, damp cloth or an ice pack wrapped in a towel to the affected area can help soothe itching and reduce swelling. Keep the compress on for 10 to 15 minutes at a time. Avoid using ice directly on the skin, as this can cause further irritation. Cooling the skin can provide immediate relief and help you feel more comfortable. Tight or rough clothing can irritate hives and make itching worse. Opt for loose, soft fabrics like cotton to minimize friction against your skin. Changing into comfortable clothing can help prevent further irritation and allow your skin to heal more quickly. It can be tempting to scratch hives, but doing so can damage the skin and increase the risk of infection. Try to keep your hands away from the affected areas. If itching is severe, use a cool compress or consider over-the-counter remedies to help control the urge to scratch. For many people, over-the-counter antihistamines like cetirizine or loratadine can help relieve itching and reduce hives. Always follow the dosing instructions on the package, and consult your doctor if you have any questions or are taking other medications. Avoid sedating antihistamines if you need to stay alert, especially during the day. Hot water can make itching and irritation worse. Instead, opt for a cool or lukewarm shower to help soothe your skin. Use gentle, fragrance-free cleansers and avoid scrubbing the affected areas. Pat your skin dry with a soft towel after bathing. Applying a gentle, fragrance-free moisturizer can help soothe dry or irritated skin. Choose products designed for sensitive skin and avoid those with added scents or harsh chemicals. Moisturizing after bathing can lock in moisture and support skin healing. Drinking plenty of water helps keep your skin hydrated and supports overall health. Staying well hydrated can also help your body recover from allergic reactions more efficiently. Aim for at least 8 glasses of water a day, unless your doctor advises otherwise. Keep an eye on your symptoms as you manage hives at home. Note any changes in the size, number, or location of the welts, as well as any new symptoms like swelling or difficulty breathing. Monitoring your condition helps you decide if you need to seek medical attention. If your hives last more than a few days, are extremely uncomfortable, or are accompanied by symptoms like swelling of the lips, tongue, or throat, difficulty breathing, or dizziness, seek medical attention immediately. These could be signs of a serious allergic reaction that requires prompt treatment. If you know you have allergies to certain foods, medications, or environmental factors, do your best to avoid them. Read labels carefully, ask about ingredients when eating out, and inform your healthcare provider about your allergies. Prevention is key to avoiding future outbreaks. Keeping a diary of your symptoms, foods, medications, and activities can help you and your doctor identify potential triggers. Record when hives appear, what you ate, any new products you used, and your environment. This information can be invaluable for future prevention and treatment. Allow your body time to recover by getting plenty of rest. Stress and fatigue can make hives worse, so prioritize sleep and relaxation. A calm environment can help your immune system function optimally and speed up recovery. Alcohol and caffeinated beverages can sometimes worsen hives or interact with medications. It's best to avoid these drinks while you're experiencing symptoms. Stick to water and non-irritating fluids to support your recovery. Sunlight can sometimes aggravate hives, especially if your skin is already sensitive. Stay indoors or in the shade during peak sunlight hours, and wear protective clothing if you need to go outside. This can help prevent further irritation and support healing. Heat can make hives worse. Avoid hot baths, saunas, or strenuous exercise that causes you to overheat. Keep your environment cool and comfortable to help reduce symptoms and promote recovery. Fragrances in soaps, lotions, and detergents can irritate sensitive skin and worsen hives. Use unscented, hypoallergenic products whenever possible. This simple switch can make a big difference in your comfort and recovery. Be gentle with your skin while you have hives. Avoid exfoliating scrubs, harsh towels, or vigorous rubbing. Pat your skin dry after washing and use soft fabrics for towels and bedding. Treating your skin with care can help prevent further irritation. While you may hear about various home remedies for hives, it's best to avoid unproven treatments. Some substances can actually make symptoms worse or cause allergic reactions. Stick to safe, evidence-based methods like cool compresses and antihistamines. If a child develops hives, follow the same basic steps as for adults. Remove triggers, use cool compresses, and consider antihistamines if recommended by a doctor. Monitor for severe symptoms and seek medical attention if there are any signs of difficulty breathing or swelling. Older adults may be more sensitive to medications and skin irritation. Use gentle care, avoid harsh products, and consult a healthcare provider before starting any new medication, including over-the-counter antihistamines. Monitor for any unusual symptoms and seek help if needed. If you are pregnant and develop hives, consult your healthcare provider before taking any medication, including antihistamines. Some medications may not be safe during pregnancy. Focus on non-medication approaches like cool compresses and gentle skincare. If you experience hives that last for more than 6 weeks or recur frequently, you may have chronic urticaria. In this case, it's important to see a healthcare provider for evaluation and management. Chronic hives may require prescription medications or further testing to identify underlying causes. If you discover a new allergy, document it and inform your healthcare provider. Carry a list of your allergies with you, especially if you have a history of severe reactions. This information can be crucial in an emergency. If you have a known history of severe allergic reactions, work with your doctor to develop an emergency action plan. This may include carrying an epinephrine, auto-injector, and knowing when to use it. Share your plan with family and friends so they can assist if needed. Anaphylaxis is a severe, potentially life-threatening allergic reaction that can occur with hives. Symptoms include swelling of the face or throat, difficulty breathing, rapid heartbeat, and a drop in blood pressure. If you suspect anaphylaxis, use an epinephrine auto-injector if available, and call emergency services immediately. Antihistamines work by blocking the effects of histamine, a chemical released during allergic reactions that causes itching and swelling. Non-sedating antihistamines are often preferred for daytime use, while sedating types may be used at night if itching interferes with sleep. Always use as directed. When dealing with hives, avoid scratching, using harsh soaps, or applying unproven home remedies. Do not ignore severe symptoms or delay seeking medical attention if you experience swelling or difficulty breathing. Taking the wrong steps can worsen your condition or delay necessary treatment. There are many myths about hives, such as the idea that they are always caused by food allergies or that they are contagious. In reality, hives can have many triggers and are not contagious. Understanding the facts helps you respond appropriately and avoid unnecessary worry. If you have frequent or severe hives, or if they interfere with your daily life, consider seeing an allergist or dermatologist. Specialists can help identify triggers, recommend advanced treatments, and provide guidance for long-term management. Creating a safe home environment can help prevent hives. Keep your living space clean, avoid known allergens, and use gentle cleaning products. Regularly wash bedding and clothing in fragrance-free detergents to reduce skin irritation. Pet dander can be a trigger for some people with hives. If you suspect your pet is causing symptoms, keep them out of your bedroom and clean your home regularly. Bathing pets and using air purifiers can also help reduce dander. Use fragrance-free, hypoallergenic detergents for washing clothes and bedding. Avoid fabric softeners and dryer sheets with added scents. These simple changes can help prevent skin irritation and reduce the risk of hives. When traveling, bring your own toiletries and medications. Inform travel companions about your allergies and have an emergency plan in place. Being prepared can help you manage hives safely, even when away from home. Stress can trigger or worsen hives for some people. Practice stress-reducing techniques like deep breathing, meditation, or gentle exercise. Taking care of your mental health can have a positive impact on your skin and overall well-being. Exercise can sometimes trigger hives, especially in hot or humid conditions. If you notice hives after physical activity, try exercising in a cool environment and wear loose, breathable clothing. Stay hydrated and avoid overexertion. Hives are just one type of skin reaction. Other conditions, like eczema or contact dermatitis, can look similar but require different care. If you're unsure whether your rash is hives, consult a healthcare provider for an accurate diagnosis. To recap, the safest way to respond to hives at home includes removing triggers, using cool compresses, wearing loose clothing, avoiding scratching, and considering antihistamines if appropriate. Monitor your symptoms and seek medical help if you experience severe reactions. With these steps, most cases of hives can be managed safely at home. If you're ever unsure about how to manage hives or if your symptoms are worsening, don't hesitate to contact a healthcare provider. It's always better to ask for guidance than to risk complications. Your health and safety come first. Hives can be uncomfortable, but with the right knowledge and precautions, you can manage them safely at home. Remember to stay calm, follow evidence-based steps, and seek help if needed. Taking care of your skin and overall health will help you recover quickly and prevent future outbreaks.